Opioid misuse and abuse may be one of the most significant public health issues of our lifetime. Pharmacists are on the front lines combating the opioid epidemic. We now have limits on initial day supply, improvements in naloxone availability, and prior authorizations for high-risk misuse situations. What else can be done to ensure we are on the right track? I'm Mark Conklin with Pharmacy Quality Solutions. Today we're going to explore opioid misuse. Specifically, we'll discuss quality measures that can help you identify particularly risky situations. There are two measures that specifically look at opioid usage: use of opioids at high doses in patients without cancer, and concurrent use of opioids and benzodiazepines. The first measure is use of opioids at high doses in patients without cancer. This measure is developed and endorsed by the Pharmacy Quality Alliance and uses drug claims data. It looks for patients who are receiving high doses of opioid medications for more than 90 straight days. What is considered a high dose? Morphine milligram equivalents, or MME, is used to consistently evaluate doses of opioid medications. High-potency medications like fentanyl have a high MME, while low-potency medications like tramadol have a very low MME. High MME situations are not always an opioid misuse situation. As pharmacists, it is our job to work with patients to understand the specific pain management circumstances, spot the high-risk behaviors, and help them manage their pain effectively. High-risk situations may include filling prescriptions too soon, quickly escalating the doses of opioid medications, or changing prescribers often. Knowing the warning signs will help you effectively manage opioid use among the patients you serve. The next measure is the concurrent use of opioids and benzodiazepines. This measure also was developed by the Pharmacy Quality Alliance and uses drug claims data. First, the measure looks for patients who have received an opioid prescription during the measurement period. This is the denominator. For the numerator, we look for any benzodiazepine prescriptions that overlap an opioid prescription. Overlap means that prescriptions were dispensed and had day supply values that overlap the same calendar day. To be eligible for the numerator, patients have to have 30 cumulative days of overlap. Patients with a diagnosis of cancer are also excluded from this measure. By managing these measures, you can better understand how your pharmacy is performing and how it compares to managing opioids versus other pharmacies. Opioid misuse will continue to be a significant public health concern. Pharmacists will be on the front lines, monitoring their patients' pain management needs. Until next time, I'm Mark Conklin with Pharmacy Quality Solutions.